Hey, Dr. Marshall with Powdersville Wellness. We're talking a little bit of a series about who should be adjusted. We've talked about pregnant patients. We talked about babies out of the womb. Let's talk about some young kids and adolescents. So you're like, well, why would a kid need to be adjusted? Now, we're not going to be using the same force and same techniques that we do with an adult. We take great care and skill in putting the pressure on the spine to do those adjustments, but we're not doing a lot of the rotation and a lot of the drops and pressure in there. But young kids need the same care that adults need as well, because you want stress off of your spine to allow your nervous system to function at its best. And again, that is your brain's communicating through your spinal cord to every cell and tissue in your body through the nerves that exit each level of your spine. So if there's stress on a vertebra, stress on that joint, then it will translate to stress on your spinal cord, potentially, and on the nerves that exit that level. So that can affect everything. Well, what else happens too? Young kids are running, playing, they're falling, they're trying to get up and crawl and grow, and they can stump themselves, hit themselves in different parts of the body. And you want to check those things out just to make sure there's not any lasting injury or any subluxations, we call it, where those vertebrae have shifted, putting some pressure on those joints. And when we do that, that clears the body, that allows them to get back to functioning at an optimal level and allows their body to heal. If you leave those there, then that kind of sets them up for deficits and dysfunction later on in life. And then as an adult, they may have to overcome challenges that, they really faced when they were younger that didn't get cleared and didn't get taken care of. So we want to address those things, and we want those kids to thrive. Now, I'm not telling you, bring your kids in multiple times a week. Most of the time kids are pretty young and resilient. You adjust them a couple of times and then they're good for, monthly maintenance or maybe even every couple months. Now, early on, you may have to see them a couple of times or a few visits if they're getting ear infections or if they've fallen and they have some trauma there. And what about x-rays? Do we x-ray kids? Typically not until they're age 5 or 6 or a little older than that, because you want to also start looking for scoliosis. If you catch it early, you can apply the right corrections and the right care to help keep that from progressing. Now, if you don't detect it and you don't wait until they're a teen or older, when the growth plate stops, then you're not really going to make any changes in there because that's kind of already set in place. Now, you can still do care, and we do have tractions and therapies and devices that can help with adult scoliosis or adult translations and flexions in the spine, where we can take those out with the proper care. It's just as a kid, you're still growing and your spine is changing more rapidly. So you want to know if they have the scoliosis. You want to know if those things are in their spine so you can address it while they're growing so they don't grow into a bad spine that then 20 years down the road, they're going to have a lot of problems and like, why didn't you fix this? Well, I didn't know about it. Well, now I'm telling you to get it checked out so you don't have to worry about it, so you do know about it, and so that we can help you.